He will not speak to Ed. Like Ed keeps on coming saying, please talk to me. I can help get you the records. And he keeps on responding back via email. And, so, I mean, no, he has refused to take and actually said that, I guess, and I mean, he's like, but if we can speak.
Here.
Gentlemen, welcome to the Southern Nevada Health District Board of Health meeting on October 23rd, 2025. We're calling this meeting to order at 9:02 a.m. At this time, we'll have the Pledge of Allegiance. I'm sorry, the roll call by Andrea, followed by the Pledge of Allegiance.
Member Becker? Chair Black?
Here.
Member Bond? Member Bruni? Member Gallo?
Present.
Here. Member Hardy?
Here.
Member Kirkpatrick? Here. Member Larson? Member Nemec? Member Nielsen?
Here.
And Member Summers Armstrong. We do have quorum.
Okay, thank you. If you will all join us in the Pledge of Allegiance, please. Thank you so much. We have a nice full crowd today. It made the pledge sound very robust. So thank you, like a pledge choir. Pretty awesome. I know many of you are here relative to the ISDS, the septic tank discussions. And I need to, number one, thank you for being here, for expressing your interest and concern. Also to apologize to you for the glitch in the online posting of the agenda, which under the second public comment indicated that there would be a discussion on the agenda today relative to septic system regulations. That is not the case. We heard loud and clear last month from the community that we need to engage in a significant and robust discussion in neighborhoods and communities throughout Southern Nevada relative to the staff and the health district's desire to revise the ISDS regulations. So after the first of the year, conversations will resume surrounding this topic. Schedules will be posted with meetings at locations that are hopefully accessible to any interested parties all throughout Southern Nevada. Postcards will be sent out. Communications will be done through media and various channels. So everyone is informed of what's going on, when it's occurring, and what the topics will be that are discussed. And as that conversation proceeds through the community, we anticipate that it will ultimately culminate in a revised set of septic regulations. Now, the health district and our staff and the board, our role and mission is public health, and focusing on that in many aspects. Your concern being here today as homeowners, as residents, as taxpayers, and as folks with septic systems on your property want to understand and weigh in on what potential impacts may be present. And so having those two parties, those robust discussions, and the opportunity to get to a point of reasonableness with public health and safety and homeowners in mind, that's the goal. So you're welcome. We'd love to hear your comments. If you'd like to share them, those would take place during the second public comment, since it's not an agendized item today. So just wanted to put that out there. Thank you all for being here. And now we'll go on with our agenda. The item that we'll go to now is recognitions. each month we have the opportunity, it's exciting each month to recognize the good work that's done by our health district staff. We have a staff that is committed to our community and does incredible things. And so today we are recognizing Dr. Eric Lopez, Dr. Anil Mangala, Rebecca Topol, and Lee Zhang for co-authoring the published article examining disparities in COVID-19 hospitalization outcomes in Southern Nevada by vaccination status in the Nevada Journal of Public Health. The study examined predictors of COVID-19 outcomes by race and ethnicity, vaccination status, age, sex, marital status, and insurance payer status among COVID-19 patients who were admitted to the hospital. The study concluded that work is needed to identify and address barriers to vaccine uptake in communities with high social vulnerability. On behalf of the Health District and the Board of Health, congratulations to these three individuals. So please join me in congratulating them for their hard work and their contributions. And we're going to pause really quick, meet over there for a quick photograph with these three awesome individuals, and then we'll be back with our agenda. 4 individuals. Yeah, my math is off. Thank you. It's okay. I think so. It's very important. Okay, now we'll go to item number 4 on our agenda today. First, public comment, a period devoted to comments by the general public about those items appearing on our agenda today. Comments will be limited to 5 minutes per speaker. Please clearly state and spell your name for the record. If any member of the board wishes to extend the length of the presentation, this may be done by the chair or by a board majority vote. There will be 2 comment periods. Again, the septic system conversation is not an agendized item, so we're looking forward to hearing your comments and thoughts during the second public comment. So at this time, anyone that would like to speak on posted agenda items, now's your opportunity to do so. Seeing no one coming forward, Andrea, do we have any written comments that need to be put onto the record?
Not with respect to the agenda, and there's no one online for public comment.
Well, if that's the case, then we will close the public comment, first public comment, and go to agenda item number 5, adoption of the October 23, 2025 agenda. Chair will take a motion to adopt the agenda.
Second.
We have a motion and a second. All in favor say aye. 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 Any
Aye.
opposition? For those of you that are joining us, board members online, if you will just speak up if you have any opposition, state your name along with that. That passes. Thank you. Now we'll go to item number 6, which is our consent agenda. Are there any comments or questions from the board regarding the consent agenda? If not, I will entertain a motion.
Move to approve.
Second.
We have a motion and a second. All in favor say aye.
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 Any opposition? That motion passes. Thank you. Now we'll go to item number 7. Number 1 is our public hearing action memorandum 03-26, request for approval of renewal of authorization of St. Rose Sienna as a level 3 trauma center. Turn it over to our staff. Good morning.
I think am I on?
Yep, we can hear you.
Good morning. I'm Stacy Johnson. I'm from the our office here, EMS and Trauma. I am here to present to you the request for approval of a renewal of authorization for St. Rose Sienna as a level 3 trauma center. Regulation 300.200 outlines the renewal process without a change in level. They have submitted their application and they are compliant with regulations, and our office recommends approval of their renewal.
Hey, does that complete your presentation?
It does.
Thank you. This is a public hearing item, so at this time I will open it up for anyone who would like to speak on this agenda item in this public hearing. Seeing no one coming forward, close the public hearing, and I'll turn it over to the board for a motion.
Second.
We have a motion in 2 seconds, but we'll take the first one. Got to be quick with the second. All in favor, say aye.
Aye.
Any opposed?
Aye.
That passes. Thank you so much. And now our next item is Memorandum 04-26, request for approval of renewal of authorization of Sunrise as a level 2 trauma center.
Yes, same thing. So we have 300.200 outlines the renewal without a change of level. They have also submitted an application for their renewal as a level 2 trauma center. We have reviewed it. They are compliant with regulations and our office recommends approval.
Thank you. This is a public hearing item. I'll open the public hearing at this time. Anyone like to speak on this agenda item in this public hearing? Seeing no one coming forward, close the public hearing and I'll turn it over to the board for a motion.
Move to approve.
Okay, we have a motion and a second. All in favor, say aye. Aye.
Aye.
Any opposition? Hearing no opposition, that motion passes. Thank you, Stacy. All right, now we'll go to item number 8 on our agenda. 8.1 is approval of the 2026 Board of Health meeting schedule. We're going to meet next year too? Just kidding. Gonna have good meetings next year. I know we will. So is there discussion on that? It's up there on the board. Any comments from our board members regarding everyone going to be in attendance and on time next? Yep, we're going to make it.
I normally have the water district. Some people have that housing authority, so everybody will be able to adjust.
Does that work for everyone for that one? Every meeting will be at 9 a.m. We have, yeah, because we move it a week earlier, because of Thanksgiving and because of the other boards that we're on. Like you said, we're in water authority together, other boards. So, any comments or questions? If not, the chair will entertain a motion to approve the 2026 board meeting schedule. We have a motion and a second. All in favor, say aye.
Aye.
Any opposition? Hearing none, that passes. Thank you. All right, we'll go to item number 9, board reports. Are there any items that the board members would like to bring forward today to have discussed as an agenda item on a future meeting, or updates that they would like to share from your respective jurisdictions? Yes, ma'am. It is.
Entertained a discussion and gave some direction for our mosquito abatement process. It is my hope that the health district is part of those conversations very early on. So I think that, we also probably need to pass back around the fight the bite kind of materials that we had on the we did a presentation. We always do one right in the spring, so maybe we can send that back out so we can share with our colleagues. But the county is very much interested in looking at what it would take for a mosquito abatement and what the cost is. And one of the number one things, at least we know from the county, is that we'll need to go on private property in the abate the mosquitoes, because that's typically where they are. I know, but I did mention that North Las Vegas had used that primer stuff on the walls. And so they're interested in learning about that.
Yeah, and I'll just say that our staff under Christopher Saxton did have a staff attend that meeting, and they created a summary and shared that widely with those who would be involved in trying to stand up that program.
Right. Any other comments or from the board members? All right, then we'll go to item number 10, health officer and staff reports. Dr. Lockett.
Well, good morning. I just wanted to visit the measles situation. And so as all of you are aware, the Southern Nevada Health District has confirmed that an out-of-state visitor who traveled through Harry Reid International Airport on Monday October the 13th, tested positive for measles. The exposure occurred at Terminal 3E gates with a departure that occurred around 9 o'clock. The individual.
Dr. Lockett, I'm sorry. Your microphone is pretty quiet.
Is
Can
it?
you get a little closer, or is there a way to turn his microphone up?
Testing 1, 2, 3.
It's a little bit, let's crank it up to 10. Let's get excited here. Dr. Lockett's report. We got to get excited.
I can hear it in Boulder City if that helps.
It's awesome. All right. Thanks, Dr. Hardy.
Here.
Perfect. All right, so let's just get back into it. So the exposure of this measles from a visitor from out of town or out of our state occurred at Terminal 3 E gates with a departure that occurred around 8 o'clock in the morning. The individual did not visit other locations in Clark County. Meanwhile, our team continues to investigate, and while under investigation, no other details are available at this time. Measles, just to point out a couple of things about measles. Measles has an incubation period of 7 to 21 days, meaning people exposed on October the 13th could begin to develop symptoms between October 20th, 3 days ago, up until November 3rd. Just for the public, symptoms typically begin with a fever, a cough. Some people have a runny nose, watery eyes, red eyes, and then it's followed by a characteristic rash. And so that rash usually presents itself initially on the face and then goes behind the ears, gets to the trunk, spreads to the arms, and then the legs. And so with that said, the rash typically kind of looks like red or dark kind of circles called macules. And then those macules will progress to some papules and vesicles, and then they will turn to pustules and crust over a little bit or turn to scabs. That's just like the progression as that rash is trying to resolve itself. So that's for the public. Also, a person with measles is contagious from 4 days before through 4 days after the appearance of the rash. And because the virus can remain in the air for up to 2 hours after an infected person leaves an area, anyone who was in Terminal 3 E gates or at shortly after that time should review their immunization records, ensure they have received at least 2 doses of MMR vaccine, and contact their healthcare provider or the health district if they develop symptoms. Just to give a global sense of what's been happening with measles and just give a quick update there, as of October the 21st of this year, a total of 1,618 confirmed measles cases were reported to the CDC across 42 states. There have been 43 outbreaks reported in 2025, and 87% of all confirmed cases are outbreak associated. In 2024, only 16 outbreaks were reported and 69 were outbreak associated, just to compare 25 to 2024. And there's been a total deaths of 3 thus far of measles cases that have been confirmed in the United States. At this time, there is no evidence of community spread linked to these cases, and Clark County has not had a resident case of measles since 2018. Though there was an exposure from another visitor in April of 2024 with no local spread. Last thing I want to say is basically to the public, the best way to protect yourself and your family from measles is through vaccination. Through children should receive 2 doses. And just as a reminder, 2 doses is 97% efficacious. 1 dose is 93% efficacious. This is a really great vaccine that's been around for a very long time. And most adults born after 1957 should have at least 1 dose. We do recommend for anybody in sort of at higher risk, individuals who might be traveling or a healthcare provider, check their status and try to get 2 of those. But I'm going to encourage everyone to stay up to date on your vaccinations, practice good hygiene, and monitor reliable public health updates when we give those. And so with that said, any questions?
I have one question for, so likely it would have been our employees that were more impacted than the passengers that were traveling. wherever the destination was. I'm sure that's how we found out that we were notified. So and I brought it up at the emergent issues this week. So are we doing everything that we need for our employees that may have worked in that gate? Because I just think that a lot of people, to update your vaccines, what does that mean, right? Is there a one sheet that was provided to them? Can you give me a one sheet I could share with them, or what does
Yeah,
that
we
look
can
like?
we can get one sheet for sure. We do have things organized that way, and Andrea, we can get that to you so you can give to the Clark County employees that work at the airport for sure. And just to let you know, I mean, I'll just make one more comment because it's been discussed in many different outlets about how contagious measles really is. And so let me put it in perspective of whether you're vaccinated or not. So, measles vaccine has what they call a reproductive sort of number of about between 12 and 18. So what does that mean? That means like if you're in a audience and there's 100 people in a room and they're all unvaccinated, up to 18 people will get measles. That's super infectious. The only thing that comes out close to that is whooping cough or pertussis, followed by the Omicron variants that we see now with COVID-19, which hover around 10 to 12. Something like flu, we're looking at a reproductive number close to around 2. But let's just say 95 people in a room of 100, let's say they're vaccinated with one dose, just one dose only, just one dose. Okay, high reproductive number, 12 to 18. And so what happens, you get a little bit of herd immunity, 93% efficacious. You can do this calculation, and what you'll find out is you will have up to 2 people instead of 18 infected. That's really good herd immunity there. However, 2 cases can produce an outbreak, right? So we don't want to see that. So what's next? Well, let's take those 95 people out of 100 and give them 2 doses. You most likely in that scenario will be likely to see 1. So that's why it's important to go out and get the MMR vaccine. It's really highly effective and it's very safe. And it's been around for decades and it's proven. But we will just wanted to point that out because measles not only is highly infectious, it's really good at finding unvaccinated people. That's what it does. It doesn't matter who you are, what you look like, what you believe in. It's really good at finding unvaccinated people. So I just wanted to point that out, and we will work on trying to get you that fact sheet. So next, I would like to call up Dr. Suge, Shannon, and Dr. Carter to provide the board with a vaccination update.
Good morning.
Good morning. So for the record, Roseanne Suge, medical epidemiologist, Division of Disease Surveillance and Control. And the mic's on? Okay, just checking. So today we are going to be giving an update on immunization specifically for respiratory viruses. So this is more informational as to what's going on with seasonal vaccines for respiratory viruses. This is a brief overview of the discussion we're going to be having. I'm going to be giving a background timeline for respiratory season vaccines. And really, this builds context as to how these vaccines are approved and go through the life cycle of approval every season. After that, Shannon will talk about immunization uptake in 2025-26. And specifically, this is the uptake here at the district. And Dr. Carter will bring us home with SNHD response to what's been going on this season. So the typical timeline for seasonal viral respiratory immunizations, usually at about February, March of every year, global flu surveillance, which happens all year round, takes a look at what's been going on. And with that global flu surveillance, they determined which strains were highly pathogenic and select strains or try to pinpoint which strains will be part of the next flu vaccine. Typically by March or August, the FDA takes a look at all of that information and recommends which strains should be part of the components of the new formulation. And at around that time, between March and August, the FDA will also authorize the new vaccine. At around June, ACIP, which is the Advisory Committee of Immunization Practices out of the CDC, will meet and talk about those vaccines and their recommendations. And then the CDC director approves those recommendations. At around that same time, the manufacturers around March and April of the year will start to formulate the vaccine and redesign it for the next season. So at this point, they're looking at the safety of the vaccine, they're looking at immunogenicity of the vaccine that they're creating, as well as the quality. Typically by April to September, manufacturers start to produce the approved products. Federally funded immunization programs start to negotiate pricing based on ACIP recommendations, and distribution rollout and monitoring of that vaccine happens. Obviously, through that whole time, there's effectiveness and safety monitoring ongoing. And then typically at about September onwards is when we start to get those shots in arms. So what happened this year? So the timeline for COVID vaccines this year, typically May 22, 2025, the FDA released what they thought should be part of the COVID vaccine formulation for 25-26 respiratory season. Below in parentheses are sort of the anchor dates from last year's season and how this vaccine cycle happened. So this happened in June of 2024. And you can see below, ACIP also by June had recommendations for flu and RSV for this year, whereas last year they had flu, RSV, and COVID recommendations ready in June. So just a little bit of background, really what happened was about February of this year, ACIP had postponed their regular meeting. And in about, I believe it was April or May, they changed the whole ACIP committee at the CDC. And so there was a little bit of a postponement in terms of when these recommendations came out of the CDC. So in August of this year, the FDA approved the COVID formulation. The indications on the FDA package insert talked about vaccinating people 65 and older, and for 6 months to 64 years, only those with certain medical conditions. So this is a departure from previously how we have used the COVID vaccine. In September, the ACIP finally met to give their recommendations for COVID vaccinations, and on October 6, the CDC adopted those ACIP recommendations. In those recommendations, COVID specifically is recommended as an individual decision-making vaccine for 6 months and older. So what you can see is this time gap between August 27 to September 18. And really what happened was stakeholders all across the nation recognized that vacuum in terms of what do we do with COVID vaccines this year. There were no ACIP recommendations available. And so the response across the nation, multiple professional organizations, whether it was the American Academy of Pediatrics, the American College of Gynecology, American Academy of Family Practice, all put in their recommendations for how COVID vaccines should be done. State and locally, there were various approaches all across the nation. Some states clarified who could give vaccines, when vaccines could be done. Standing orders were also in place. So locally here at the district, we had standing orders in place, I believe, since September 10, and Dr. Carter will speak to that as well. But this is what happened in terms of the timeline. And so with some of those national responses, some states actually formed alliances as well to bring up their own recommendations. And with that, because SNHD did have standing orders early, I want to turn it over to Shannon to talk about what our numbers look like at the district.
So safe. It's not on.
Is the green light on? Oh, there's no green light. All right, let's do musical chairs. Why don't you guys switch?
So this slide here is looking back over the past 5 years with COVID, flu, and RSV. vaccinations here at the health district. So this is just here with our immunization clinics, and not a broad view of the whole community, but just to show that back in 2021, you can see the response for COVID vaccination was extremely high in September, continued in October. And as we've gone through the past 5 years, kind of the decrease in the number of COVID vaccines that we have given this year compared to last year. In September, we have given, we did give 95 of our COVID vaccines in September versus 193 the year before. Each September is usually when the new presentation comes out. So there is a little bit of a delay, and you'll see that uptake come October and November. This year, we were able to receive our Pfizer vaccine for COVID on September 10th, and also our flu. And both of those was what we call private or cell presentations. So it was a little bit further along in the month before we were able to receive the state funded, our VFC or 317 vaccine, and also a little bit more of a delay for us to be able to get our Moderna vaccine. But this graph just pretty much shows you what the uptake has been over the past 5 years and this year compared to last year. Our flu has stayed relatively stable. We had an increase in 22 and 23, and this year a little bit less than last year, but we expect that to pick up again in October. Are there any questions about the presentations or the flu vaccines?
Any questions for Shannon?
I do, Mr. Chair. I have one.
Yeah.
Yeah.
Can you hear me?
Yes.
So could you explain how the money is following these vaccines? If there's been a delay in recommendations or change in recommendations, and now it's like a self-decision, does money follow the self-decision if people choose to get vaccinated, or has there been a change in the public funding for these vaccines that's impacting the opportunity to be vaccinated?
A little bit of a delay this year in waiting for ACIP for our state funded. But I will say that it was as soon as that was finalized, that the state was very quick within a few days of being able to get us the VFC and the 317 state funded vaccine. Our response here at the health district for any clients that came in that were underinsured or uninsured, we did keep an ongoing list, and we contacted everybody the same afternoon that they were received in the clinic, and have started vaccinating everybody that was on the list. So that was really good.
Thank you.
RSV, the numbers are lower, and but with I call it the Beyfortus, we are seeing an increase actually in that here this year compared to last year. And pediatricians and our pulmonary specialists do receive the state funded VFC, but a lot of them don't carry what we call the private or the cell. So we've been really able to help fill in that gap for the community.
And has that changed at all? I'm sorry, I should have asked for follow-up. Has that changed the ability to provide for the gap? Has that?
Yeah, so
That's been not
RSV
disrupted.
really wasn't affected by ACIP, so that we've been kind of steady. October 1st is for our infants are, going into their first respiratory season, or a high risk going into their secondary. October 1st is kind of that magic date for that. For age 75 and above, we provide all year long. And then for women who are pregnant that need to receive the RSV immunization, we stop that in September. So that's not been affected at all.
Any other questions from the board? Okay, thank you. Dr. Carter.
Play musical chairs again.
Yeah, it's fun. We'll get a handheld mic here next month so we can pass the mic. Yeah.
Good morning. For the record, I'm Robin Carter. I'm the CMO for the district. And I'm going to go over our COVID standing order. So this order was written in preparation for the ACIP guidelines that we anticipated were going to be very restrictive for the vaccine. And we wanted to eliminate the barriers for those who wanted to get the vaccine so that it was available for them. Initially, it was only for the cell vaccines because we have to wait for the ACIP guidelines in order to apply those to the VFC in 317. The order was based on the Colorado order because that one seemed to be the most complete and came out fairly quickly. And we didn't want to waste any time, obviously. Whoops, sorry, wrong way. So the purpose of the standing order was to reduce the morbidity and mortality from COVID-19. The standing order delegates the authority to specifically our immunizations clinic, but also anybody here at the district. It is district only. It does not apply again to Clark County or the state in general. But the purpose was to take the guidelines that we had received from all of the professional academies, along with the University of Minnesota Vaccine Integrity Project, and use those so that we could now make the decision to get the shots in the arms for those who wanted it. The policy, the health district believes that COVID-19 is a cost-effective public health tool to mitigate the spread, morbidity, and mortality of COVID-19. That hasn't changed since it started. So the policy allows myself as the CMO to provide a standing order so that, again, that our providers here at the district could provide the vaccine to those who wanted it without having to see a clinician first or to come in with a prescription or something like that. They could come in and request the vaccine. And our nurses giving the vaccine now have the authority to do so. It only applied to Moderna and the Pfizer. We didn't have the Moderna at the time, so when this was signed on September 22nd, it technically only applied to Pfizer, but now that we have Moderna, it applies there as well. So just a little bit, the purpose and the scope we've kind of gone over, but the policy itself, I'm not sure if you had a copy or not, but what it does is it outlines all of the age groups. So we have broken it down into the 2 to 4 year olds, and because that's the Pfizer specific, the Moderna specific, the Pfizer goes up a little bit higher. But we have outlined the procedures for everybody to get the shots. This stands for our nurses and just outlines the procedure for them. We did, once we got the final ACIP recommendations, we did add the verbiage in here that for the cell vaccine, individual decision-making does not necessarily apply. You can still use it. It doesn't prevent us from using individual decision-making, but it doesn't require it for the cell vaccines. For the VFC and 317, though, those are federally funded, so the individual decision-making is required for those vaccines for anybody who does not qualify as 64 or older, 65 or older with the medical condition. So that's the gist of it. Questions?
Any questions for Dr. Carter? Dr. Nemec, yes, sir.
So are these standing orders the same as the CDC recommendations? And are they similar to the West Coast Alliance?
They're similar, yes. They're based on the academies, the professional academies, and not the CDC specifically. The CDC specifically now says individual decision-making, where we took that out for the cell vaccines. And it's still out. Like I said, we can still use the decision-making, but it is not required for those cell vaccines. But it is required for the federally funded vaccines now that the ACIP recommendation has come out.
Thank you.
Mm-hmm.
Any other questions? Are there questions from the board members that are joining us online today? Okay.
No.
And that concludes our presentation. Thank you.
Thank you. Thank you all for that presentation. Now we'll go to item number 11 on our agenda. I'll refer you, the board members to the informational items from the various divisions within the district for updates on reports. Oh, absolutely. Commissioner Kirkpatrick.
See that we've had a little bit more closures than normal, and I see that it's ethnic type facilities. And the last time that we had that same issue in like the Asian community, we went out and did some maybe workshops with them to kind of re-educate Is that something that we need to maybe look at going into our slower time in the spring? I'm just curious because it just seems very consistent with what the issues are, and I think we could probably educate them or at least have some translation issues there.
Yeah, we'll follow up.
All right, thank you. Now, we'll go to item number 12, the second public comment. For those of you that may have joined us after our meeting started, I stated at the beginning that the mention of septic systems or ISDS regulations in the agenda under the second public comment as it was posted online was an error. It was not a clever way for us to fill this room with amazing residents this morning, but I'm thankful that you all chose to come here today. So just so you know, it was not agendized for today. It was not an item for action. And what you can expect moving forward is after the first of the year, a series of workshops and community meetings will be published on a calendar, communicated to the public that hopefully you'll have access to throughout the community to make it convenient for those of you that would like to engage and learn and listen and be a part of the process as our staff evaluates our ISDS regulations moving forward. So with that, I'll turn it over to you all for the second public comment. This is a period devoted to comments by the general public. If any discussion, about matters relevant to the board's jurisdiction, comments will be limited to 5 minutes. If you don't mind, avoid repetition. Each speaker will be given the 5 minutes, and if we would like to extend that, that will be done by a board decision. Good morning. Thank you for being here. And by the way, this meeting went very fast, so generally the second public comment doesn't happen till well into the meeting, an hour or so. So glad you're here. Glad it was quicker than normal, so you can speak. Thank you.
Good morning. My name is Carol Reynolds, REYNOLDS. Several days after my first visit to the health department for the recent septic meeting, I got sick and had a miserable 2-week bout of strep throat. The irony of this is not lost on me, but it started me thinking about how residents' health has been affected by the water authorities, malicious water pricing, and excessive use fees. In the last 3 years of public meetings, many people have spoken about dealing with the consequences of unaffordable water. Stories of egg timers set to restrict showers, the story of a family unable to properly care for an elderly relative who required frequent showers to keep clean, stories of monitoring toilet flushes, and my own story of abandoning my dishwasher in April of 2023 so that I can tote dishwater to whatever plant is on the verge of death that day. The stress and anxiety of dealing with these deliberately punitive water policies has also negatively affected the mental health of an untold number of residents. Many people, like me, have spent decades and tens of thousands of dollars maintaining our properties. Now we are forced to watch our properties deteriorate and our lovingly tended landscapes die. This makes me heartsick. But easily the most unconscionable effort by water authorities is allowing the use of children as guinea pigs by encouraging the replacement of grass athletic fields with toxic artificial turf. When even the NFL has encouraged the use of natural grass fields for player safety, how can this be rationalized? Instead of water authorities leaning on the health department to coerce already financially stressed residents so that they can pursue their growth at any cost agenda, perhaps the health department should lean on the water authorities for endangering the health of residents. The non-existent septic problem is just a ruse to force current residents to finance unlimited growth. It is evident that by tossing the septic hot potato to the health department, the water authorities, in a thinly veiled attempt to redirect attention from themselves, are fooling no one. Thank you.
Thank you. Hi, Ms. McSwain.
Hi. Thank you, Chair Brock, and for the clarification on the confusion regarding the meetings.
Oh, really quick. Welcome to the Southern Nevada Health District. This is not the water authority.
Right.
Okay. There is a cross section,
No,
but
it
we're
is
at the
in
health
your
district. Thank you.
online.
Yes, indeed. Thank
Okay.
you.
So Laura McSwain for the record with the Water Fairness Coalition, which was established to address water policies that punitively, unfairly target and impact existing residents and the investments that they've made in their homes. Our initial mission was to address excessive use charge penalties that are a one-size-fits-all calculation regardless of property or family size. However, after becoming aware of policies implemented on multiple fronts that are not only creating financial burdens on the community, they are creating damage to essential infrastructure required for humans and wildlife to thrive, our scope has expanded, and why I'm here today. Waiting until after the new year to address the proposed changes to the septic system regulations and the processes used will be too late. Septic systems clearly go well beyond investments in landscaping. They are a requirement for the development of a home or business that is outside the affordable limits of municipal infrastructure. Investments were made, and they were allowed and permitted. Residents now fighting to reclaim the excessive use charge penalties learned the hard way about how the rules-making process works. Somehow, transparency is defined through a business impact study that allows those directly impacted to be left out and literally bypassed from the direct notification process. It should be embarrassing for anyone to accept such a study, whether it is about rates or redefining a homeowner's septic permit status. So far, it is not, and clearly something that needs to be addressed and confronted. It was told to one resident that I've spoken with who had a conversation with a member of this board that you would all be starting from scratch. But that's not really entirely true, is it? The business impact study has been completed. A do-over would involve a complete retraction of the study and the regulations as currently written. It is something residents hope you will consider and set your own course. As for the proposed regulations as currently written, there's a fundamental question on the table. Is it reasonable to take an essential facility to a home or business that came with a lifetime permit provided at the time it was developed that offers predictability and stability to the property's value, not to mention its viability as an asset, and then turn it into a permit that requires a 5-year review? Who wants to live under the cloud of the whims of bureaucracy with the only recourse being a costly waiver process? Sitting through last month's meeting, one individual had spent over $3,000 attempting to get a permit that was held up due to his septic system so that he could simply retile his bathroom. This past April, I attended a meeting where a gentleman was fighting to save the trees in his yard and was being denied a permit to build an addition that was adding literally no additional plumbing. That fiasco cost the man over $8,000. He had the resources and he was able to save his investments and his trees, but there are people out there that do not have those means, that have had to take out their trees and let landscaping die. During the workshop held on the September 24th, it was stated that the reason for the rules change had to do with community water conservation goals. The mailer notifying residents of the postponement of the public hearing originally scheduled for today's hearing states that the new regulations are to clarify language, safeguard public health and the environment, and maintain standards for residential septic systems. However, when asked, no specific problems were identified that we're solving for. Even more perplexing is the lack of information on the financial impacts to this agency to suddenly have to look at septic renewals every 5 years. Where are the videos and audio and minutes from that meeting, that workshop? In the spirit of full transparency, this information should be made available on your website, and all meetings, workshops, and hearings should be listed in one place. Currently, they are not. When you go to your website, all you find are your board meetings. There was a meeting yesterday about a previous item that you had on your agenda in the last meeting. I would have probably been interested in going because it dealt with short-term rentals. There was no way for me to know that that was happening, just going and looking at your website on a top line. Bottom line, it's time to allow for decision-making to be thoughtful, purposeful, and most importantly, honest. The damage to the community is occurring on all fronts, and it will require courage to stand against what has been put into motion. We look to you to take an approach that considers existing residents and our quality of life first when it comes to any policy changes going forward. Thank you for your time.
Thank you, Ms. McSwain. So out of, I appreciate everyone's enthusiasm. I know this is a critically important topic, or else you would not be spending your Thursday morning here with us. But if we can refrain from clapping, just so we can keep the flow of the conversation going, we know that you're enthused and interested, and we are as well. So thank you. Yeah. Okay. Yeah. Mental clapping is awesome. All right. Thank you. Sorry to interrupt you. Go ahead.
Diane Henry, Henry. First, I want to thank you for pausing the septic regulations. That's most appreciated. I understand that septic issues are likely not your forte, other than perhaps septic owners or those of you who also serve on the SNWA board, which has its own water agenda. This board is sworn to protect public health and safety. And I was impressed by the excellent questions you asked at prior meetings about the issues you face. But I think some history will provide a much needed perspective on the proposed new regulations, because this is all about getting rid of our septics to reclaim that water. No matter the cost to my family and neighbors, it's not about public health and safety, and it's certainly not about merely simplifying and clarifying existing language, as your website, postcards, and social media PR claim. In 2023, AB 220 was heavily promoted by SNWA to the Nevada legislature because extreme and unprecedented new levels of water conservation were supposedly necessary, without regard to the individual cost or impact on quality of life in Southern Nevada. That's in spite of our water experts, such as Pat Mulroy, former CEO of SNWA, who've said we cannot conserve our way out of this. Other jurisdictions have handled water conservation much differently and much more fairly, not on the backs of existing residents, who have generally done a very good job of conserving water here, by the way. But once we reached SNWA's water use benchmark of 105 gallons of water per person per day, the bar was immediately reset to a new goal of 86 gallons. So we've gotten down to 89, but what will come next when we reach 86? But I'm sorry, I digress. As far as AB 220, it's very telling that the original draft of the bill included many of the mandates now included in your proposed new regulations, such as 5-year reviews of septic permits and mandates to connect to sewer. But these were not approved by the legislature as part of the bill. This includes Section 8, Number 4, which would have criminalized any septic owner who did not comply with any provision of the septic ordinance as being guilty of a misdemeanor. But our state legislators did not agree with criminalizing homeowners who weren't able to spend at least tens of thousands to connect to sewer. So that language was removed from the bill. But without criminal charges, the only way to force septic connections at our expense is to use you to replace our lifetime septic permits with revocable permits, something the 2023 legislature did not believe was appropriate nor fair, and I hope neither will you. Vague statements about increasing nitrate levels do not constitute a public health crisis. And the EPA has also provided grant money to SNWA if septic nitrates do become a health problem in a neighborhood. Water conservation at crushing expense to individual septic owners should not be your course here. For moral, ethical, and legal reasons, please do not impose any new septic regulations until you have the funding available to help us fulfill them. Thank you very much.
Thank you, Ms. Henry. Good morning, sir.
Hi, I'm Edwin Kaehler, Kaehler. I agree completely with the previous speaker. I think the 2009 regulations do not need to be updated. They're perfectly good, and I think people with lifetime septic permits should be allowed to keep them. And so every year we have to get our cars smogged, right, in order to get our car registration renewed. And so think about the septic permit renewal like that. Okay, now the car renewal process is very clear. You take your car, it's plugged into a computer, the computer decides if the car is polluting or not. It's very clear. The qualifications for getting your septic permit renewed are not clear at all. It could be anything. That is, every septic system has some flaws in it. And the question is, how much debris on the bottom of your septic tank is acceptable? How many little chunks of concrete missing are acceptable? How many tiny leaks in your piping is acceptable? These things are not clear at all. It's as if you took your car to the DMV every year and they inspected the inside of your car to see if it was clean. Okay, now what would the rules be for that? Well, the inspector would say, well, this doesn't look so clean, you don't get a permit, It's extremely unclear and extremely unfair, and I think you should not do it at all. Leave people with their permits that last for years. When something goes wrong with your septic system, owners have tremendous motivation to fix it because it smells bad, sewage is coming up in your yard. That's the kind of thing that owners will respond to. Everything else about a septic system does not need to be repaired. We have porous soil. The water goes into the soil, there's bacteria there, and it seems to take care of itself over many years. Thank you very much.
Thank you, Mr. Kaler. Good morning.
Yvette Williams, and I live in Spring Valley. And I live on a property, as many in this room do, or those who have septic tanks, in older communities where I have two structures. And so when we talk about septic tanks, we're not talking about one septic tank. I have two septic tanks. One septic tank is in the front of my yard, which I could connect to the sewage line at probably a cost of somewhere close to about $50,000 to $100,000. But the one in the back, my guest house in the back, where my adult child lives because they can't afford rent in town, that septic tank goes uphill. So I've had estimates done, and I'm looking at close to $250,000 to install a pump and everything else that's needed to gain access from my acre lot. So it's at the back of the acre. So it's a long distance for it to go. Many of our residents live in communities where they're in cul-de-sacs and things like that, where they are quite a distance from connecting to that sewer tank. So I am not alone. I feel very strongly that we should be grandfathered in. And if this is a regulation that you want to institute in the future for new builds, so be it. But those of us who have invested in our communities and have spent a lot of money over the years, I've been in my home now for almost 3 decades. It's unfair that I would be forced to have to sell my home and even consider my forever home, leaving my forever home and moving outside of Nevada because I can no longer continue to afford to be squeezed left and right from the expensive water. I'm paying the excessive fees without any consideration of how many families may be living on my property. And when I say family, I'm talking about my extended family who now maybe have their own families. The other thing that I wanted to mention, and Diane already kind of alluded to that, is this is not the intention of our legislature. Our legislature heard us loud and clear, and they understood that this was going to be a hardship on us. And so they put regulation in place, or law in place, to protect us from that. And this seems to be not aligned to the intent of the legislature, forcing us, your constituents, to have to deal with the legislature again, fight again, spend our time, our resources to be heard. And so I just ask that you please consider that. Also, which is very important in my mind, is that our government and commissions like yours and others actually approved these septic tanks because they wanted to grow Clark County. And so because in their haste to grow Clark County, instead of putting the lines out before they sold that land and allowed those homes on, they said, oh, you have septic tanks, only to hoodwink us years later to now have to deal with having to either sell our homes because we can't afford to do that, or try to figure out how we can put these additions in. Also, lastly, I want to bring up the issue of environment. There's a lot of discussions around septic tanks in the environment, but then our local government approves contracts with companies like Boring Company, who is has recently been approved with 68 miles underground to build tunnels affecting our groundwater in our water shield. And they have had so many violations. I believe I read over 800 violations, where their current violations is in the millions of dollars, and our government reduced those penalties to thousands of dollars. How can you look in people's faces and honestly be considering something like this when we're allowing companies like Boring Company to come in and then when they violate a law, they just get a slap on the hand, and it's all at our expense, because that's what it looks like even with utilities and anything else. It all falls on the back of residents. But the businesses, no, we don't include them. But then they're the first at the table to have conversations. How is that right?
Thank you, Ms. Williams. Good to see you again, sir.
Hi there. How are you doing, Chair?
Good. Welcome back.
Good morning, board. Also, my name is Christian Salmon, Salmon, a Clark County homeowner. Under NRS 241.035, I respectfully request that my comments today be entered verbatim into the public record. I own 2 septic systems, and I believe the concerns I'm sharing today reflect many septic owners across Clark County and who also feel they would want to be expressed if they were here. This meeting is during the day, and it's hard for many to come. Thank you for allowing me to speak. I'm here to address the proposed 2025 regulations governing individual sewage disposal systems and liquid waste management. If adopted, these rules would permanently change how families like mine live, maintain their property, and even sell their homes. These regulations redefine simple maintenance as full construction. If a pump or lid fails, a homeowner could suddenly be required to obtain a full engineering permit, pay for multiple inspections, and even reconstruct their entire system. That's a major change from the practical proven methods that have been working safely for decades. The proposal also adds 5-year operating permits that expire automatically when properties transfer. That means no valid permit, no sale, turning home ownership into a revolving cycle of fees, paperwork, and inspections that never ends. Although the specific impacts may differ, for those on the Colorado River water, private wells, and rural versus city parcels, every group is being drawn into the same web of new regulation. Each of us faces different challenges under this proposal, yet we are all united in one belief that these rules go too far, too fast, and must be rejected in their entirety. Just as this regulation was introduced as one comprehensive package, it should be rejected as a whole so that all property owners, regardless of location, water source, and circumstance, can equally be protected. We all share one goal: to maintain our property rights, preserve our independence, and ensure that every homeowner in Clark County is treated fairly and consistently in liberty. Before rewriting long-standing policy, we need to ask the most basic question: is there a health emergency? No such emergency has ever been declared by SNHD, NDEP, or any other state or federal agency. If there is a public health emergency, where is the study supporting it? The district's own flyer admits that there are no documented specific failure rates or public health studies that justify these sweeping mandates. And the emergency if the emergency truly existed, Nevada law requires the public to be notified, yet there was no notice, no press release, and no outreach. It is understandable then that the citizenry is skeptical of this process. there's 18,245 of us that were notified only at the bare minimum required by law. Only after word spread among septic owners did a postcard arrive, one that contained no substantive information, collected no contact details, and promised no future communications, i.e. email. Why? That does not inspire trust. It deepens the divide between government and the people it serves. So some of us remember the early days of AB 220, which contained language that criminalized ordinary homeowners for being on a septic system. Those punitive provisions were later removed, thank goodness. Yet the 2025 proposal seems to resurrect that same idea back under a new form of enforcement. Can you imagine law-abiding families being treated like criminals simply for having their homes built and permitted decades ago? We don't deserve to be criminalized for having a septic system, do we? This proposal creates a regulatory trap that tightens over time, one permit, one inspection, and one new fee at a time, until independence gives way to permanent oversight. You'd be the PUCN effectively, and I'd be the regulated utility. That's not environmental progress. That's overreach. The true goal is protecting water. If the true goal is protecting water, then let's pursue the opportunities that will actually make a difference. Nevada currently receives about 0.85% of the total Colorado River Pact allotment, the smallest of any basin state. Instead of targeting homeowners or agencies that should be renegotiating their higher allotment and requiring other basin states to recycle their wastewater to the same standard we already achieve. Coastal states like California have the ocean at their doorstep and the ability to desalinate water. They should have been doing this before Nevadans are told to dig up their yards. One last thing is abandon your regulations, not my septic. Thank you very much.
Thank you, Mr. Salmon. Appreciate you being here again today. Good morning, ma'am.
See, I've lived in my home for 44 years. I was born in Las Vegas. What I want to do is tell you my story. When AB 220 came out, I'm interested. I'm here to tell you I'd be happy to go on city sewer. So when it came out, I started checking into it. I called the health district. They said, we don't know what's going on. Call the water authority. Called the water authority. They said, we don't know what's going on. Call the health district. I went back and forth a few times with that. The health district said, give me your name, your number. We're keeping a list. We'll get in touch with you. I've never been contacted at all. Speaking of which, I just heard today that there was a postcard. I never received a postcard about this. So then I had some friends who worked for the water authority, and I got hold of somebody there who was taking care of this. I researched it. I talked to them. We went back and forth. I figured out how this all worked, which took some doing. I wrote it up. I walked it around to each one of my neighbors because I am in an area that has lots of septic tanks, at least from my perspective, like 40 or 50. And I walked it around to each of my neighbors and said, hey, you guys, I think if we all got together and did this, we're kind of low hanging fruit. The sewer runs right in front of my house. I'm willing to do this. I'm not willing to spend $50,000, but I started going through the process. The thing says, I think it's Class C contractors. I could be wrong on that, but there are hundreds, if not thousands of Class C. You got to figure out which ones. So I had to try and figure out which ones. Then I finally got the water authority gave me a shorter list. I started calling them. I called. They all said no. I got one. They say, call so-and-so. I call so-and-so. They say no. They said, call so-and-so. I call so-and-so. They say no. I finally called. I got hold of two. One said, yeah, we'll look at it. Never got anything. I finally got hold of one who actually gave me a bid. So we're supposed to get 3 to use the AB 220 and go through that process. I worked really hard at this. I got one bid. That one bid was for $40,000. It did not include everything. It was a year ago. It did not include connection fees. It did not include landscape redesign. It did not include the best route to avoid landscape redesign. So I'm figuring $50,000 is a reasonable Didn't include inflation now a year ago. So I'm using 50,000 as a round number. And I'm low hanging fruit. $50,000 times 18,245 septic owners. That's $1 billion. $1 billion. That's a lot of money. For what? For what? I am willing to do this, folks. I'm willing to do it. I'm not willing to take the hit to the value of my property. I'm not willing to do it to take, I can't sell my house because in effect, I have a $50,000 lien against my house that you're putting on it. That's just not right. So I don't know if any of you are Aces fans. I'm an Aces fan. I just read the other day that they're worth $1 billion. The WNBA is worth $1 billion. Why are they worth $1 billion? Because there are benefits. Michael J. Fox created a foundation. His foundation has raised $2.5 billion. Again, why? Because there's a benefit here. You guys have said there's no real problem. You haven't pointed to anything. When I was here speaking before, I asked for information about what the problem was. They said, we'll send it to you. Haven't received anything. You had my name, I have my address, you have everything. I haven't received anything. Oh, I want to go backwards and say, oh, I also called the Water Reclamation District. They are paying for converting. They're paying, but they're targeting those that are problems. So they won't come to me. I wanted to do that. I have done everything to try and get this done. There aren't contractors. You can't get them. It's $1 billion. You guys are taking away a right, a right that we have been granted for no reason, no due process, no nothing. This just isn't right, folks. And if you're going to make us spend $1 billion, and that's at the low end, $2.5 billion. If you're going to make us spend $1 billion to $2.5 billion, then there needs to be a benefit for us, for the community, but we shouldn't be giving some minuscule benefit to the community on our backs. Thank you.
Ms. Casey, thank you so much for your compelling story and for sharing the details with us. Really appreciate that. Thank you. Ms. Casey, will you give your address to Andrea? Will you raise your hand, Andrea? I don't have your address. If you don't mind. Okay. All right. Thank you for indulging me. Good morning, sir.
Good morning. My name is Robert Thornley, and I live in the rural preservation area near Lone Mountain and Durango. I've been a general contractor here, served on the board of the Associated General Contractors of America, and served as chairman on the Nevada State Public Works Board. I've been a lobbyist on both state and national level. I know everyone's time here is quite valuable, so I'm going to keep it very short. Quite simply, I oppose all the proposed changes to the usage of the septic systems. And I know we can get into details after the first of the year. However, you've made a mistake in giving me a microphone, so I'm going to vent a little here on some other issues. I'm on a community well and a septic system. I feel the need to share with you some of my frustrations with the recent attacks on all of my utilities. First, to supplement our revocable water rights and assure I can repair the well should it suffer structural damage requiring redrilling, I purchased 2 acre-feet of water rights. Now I'm told if I don't use those water rights, they're going to take them away. I spent $50,000 for those 2 acre-feet of water rights to preserve my water. Obviously, if they take them away, they can force me to go to city water. Again, a very expensive connection fee, just like the septic tank. So much for trying to do the right thing there. By the way, when you read the articles about our aquifer being emptied due to overpumping by well owners, I'd like to point out, according to Vegas Drilling, this aquifer's level hasn't varied more than plus or minus 5 feet in the last 30 to 50 years. That's at least until the water district sank two 36-inch diameter super wells into our aquifer with the ability to pump millions of gallons per day from that aquifer. Next, I spent a substantial sum for home solar panels. I think we all are aware of what's been the news here lately. NVE is going to radically change the way that they calculate our power bill. In addition, they're going to make modifications to the way that they account for the energy my solar system returns. By the way, the return, the power that I give back to them, they only credit me 75% of that. So they're making money off of me there as well. So again, substantial increase in power. And last but certainly not least, along comes another government agency, the health district, to unnecessarily increase my utility costs and reduce my independence without any real good reason. I sincerely believe this is a concerted effort to first take our septic systems, then our wells. We bought and paid for our wells and septic systems. I cannot make any sense in wasting time and money for the government to make us pay for government inspections. I assume enacting the new proposed regulations will also result in an expansion of the health district. If we have a problem with our septic system, it'll quickly be very evident, and we'll have the system pumped and inspected by the pumping company, which, by the way, we regularly pump our septic tanks. No need for any additional government regulations. I think it's obvious that with 960,000 homes in Clark County, the 15 to 18,000 septic systems are a drop in the bucket when looking at recoverable water. If this is a huge issue, then why since 2020 have approximately 14,000 new home permits been issued each year? Even with desert landscaping, which is not recoverable water, the loss of water that is recovered can be between 25 to 45% due to leaks in sewer lines and the evaporation during the sewer treatment process. The cost to convert to municipal sewer can be from $40,000 to hundreds of thousands of dollars, depending on where you're at. I can't afford these kind of costs. I'm retired. These costs also, as mentioned previously, lead to a devaluation in our property. This is my forever home. I'm up in my 70s, so I'm going to be there, at least unless I get run off because I can't afford to hook into these utilities. I'm asking you to just leave well enough alone. Why doesn't everybody focus on the growth rate in Las Vegas? That's something Adina Titus has professed since early 2000.
Thank you, Mr. Thornley. That concludes your 5 minutes.
You did me in.
You went the distance, man. You said you were going to be brief. That was awesome. You nailed it. Yeah, 5 minutes. Perfect. Thank you, sir. Appreciate it. Yeah.
Morning. My name is Rick Acco. Sounds like taco without the T. I'm a realtor that covers Clark, Lincoln, and Nye counties. So I'm very familiar with septic systems and wells in rural Nevada. First, homeowners have already paid for permits and inspections when their homes were built. Adding new 5-year permits, inspections, and water tests means paying again for something that was already approved. Second, when a home buyer signs a residential purchase agreement, they already have the option to request septic and well inspections. A good realtor will make sure that those inspections are done. Costs are negotiated between the buyer and seller as part of the contract. This process already works without adding mandatory government permits and fees. Third, as a homeowner in Sandy Valley, sewer will never come to Sandy Valley. We are a rural, mountainous community with no infrastructure and no funding for conversion. Even after AB 220 passed, the health district admitted there is no program and no money to help residents. Septic is our only option. Fourth, Sandy Valley is over an hour from Las Vegas. Getting inspectors and contractors out here is difficult, takes extra time, and always costs more because of the distance. Adding new mandatory inspections will only make the process slower and more expensive. As a realtor, these changes risk slowing down sales, hurts my business, and discourages buyers by adding more red tape to every transaction. In closing, don't make people pay twice. Don't duplicate what the residential purchase agreement already covers, and don't impose urban rules on rural communities like ours. What we need is fairness, not extra bureaucracy. Thank you.
Thank you, Mr. Acco. Now all y'all want a taco because of you. Thank you. Thank you for being here. Good morning.
Good morning. Morning to the board. I'm Denise Tropia Kelly, Tropea Kelly. I live in Centennial R&P for the last 25 years. I live in an area where we have a community well and a septic system for wastewater. We've built responsibly, followed every rule, and maintained our property, maintained our wells and septic. The proposed 2025 septic regulations threaten to undo the decades of safe, affordable living for the rural community. They turn simple upkeep into government-controlled projects. Under these new rules, we're replacing a distribution box or fixing a broken line that can trigger a complete redesign of the system. And that's unreasonable and unaffordable for majority of people. In Nevada law, as we see, NRS 44.650 for septic systems and NRS 534 for wells already provides all the protection for the public needs. And there's no data showing widespread failure, pollution, or danger. And as people had said before, when we have our problems with our septic, we take care of it. The same way we're very cognizant what we put down our drains. At least my family and my community is. And these rules hardest hit where incomes are the lowest. A lot of people have put sweat equity into their homes. We have a custom home in which my husband and I built, and it doesn't make sense. Every added inspection, every travel fee, every design drives up cost for the homeowner, and they're forced to choose between, do we comply or we survive? And we all want clean water and a safe waste management. But these proposals don't protect health. They just punish our independence for wanting to live in a rural preservation. And they don't solve the problem. They create one, as we've seen, by all the costs that could be incurred. So please protect the rights of homeowners and take care of their land and water every single day that we do. So abandon your regulations, not my septic, and I feel we should be grandfathered in. Thank you.
Thank you for your comments. Good morning.
My name's Kara Walker. I live up in the rural preservation area as well. We've been up there since 2007. We built our home custom, followed all the rules, all the laws. Our septic and well system probably account for about 14% of my total mortgage, which I'm still paying for to this day for the next 14 years, which means if I have to abandon it, I'm still paying for something I'm no longer using. And that's a cost that's not fair to myself nor any other homeowner that's still paying a mortgage that includes those costs. My private system was paid for and installed by me, still on my mortgage. I understand that public health is your concern at this board, but yet there's no documentation to indicate danger in my neighborhood for the contaminants to the groundwater. Just so you know, my septic system sits probably 10 foot down. I had to drill 700 feet down. There's no way my septic system is touching the water that we are provided. Your quest for funding a program that SNWA suggested the passage of AB 220 is not to be on the backs of us who have healthy, functioning private septic systems. This board must rewrite these proposed regulations to be more specific to property owners with wells with regions that show no future public sewer like Mount Charleston and Lee Canyon. Those are just a few of the concerns I have. Thank you.
Thank you, Ms. Walker. Good morning, sir.
Morning. My name is Roy Trafton, Trafton. I did not get a card that told me this was going on. I didn't even get 24 hours notice. I'm just speaking in support of all these people that you see right now, that the issues that they've brought up are valid. We're all sitting here nodding, and I understand reducing the clapping, but please understand, there's a lot of clapping going on. But outside of this group, there's probably a lot more. We can't control all the data centers that are coming in that are sucking water like unbelievably. We cannot control all the permits that are being given to increase the population while water, of course, is not being increased. But we can ask you to please not drop such a heavy weight upon those that want you here to protect us when this is not protecting us. Our systems are safe. They're good. Should they be reviewed every 5 years? Probably not. I live alone. Mine has been there for years, and I had it inspected, and it's good. It's just a lot of, I hope that you guys are just taking what these folks are saying to heart. They're very concerned. I mean, we don't mean to bore you guys, but we need to get reconciliation. We need not to have hundreds of thousands of dollars laid on us to try and get a public utility hooked up. It's the public utility. We have to pay for it. Understood. That's what taxes and stuff are for. It's what keeps you guys here. Would just be nice if we could get grandfathered in. If our systems are safe and everything's good, it's been working. My house went in 1964. It's really safe. It would just be great if we didn't have to bear the cost of something that had to change, because we will not limit those that are coming in, companies that are expanding. This is economic, and everybody wants to make that much more money. But we have to understand there's a lot of retirees here, and we can't afford to all of a sudden just take money that we are living off of and throw it into piping and inspections and permits and a mountain of fees, fines, and what have you. These are just regular people. They're the ones that get you where you're at. We're the ones that want you to make our lives safe. This is not one of those items. And I just want to be very supportive of these folks, because I know, as a person that just retired, there's a lot of working people that are not here, that did not get a postcard, that have no idea of the reality of those few words that are on that postcard, that the costs that are going to be levied on your constituents that are trying to be healthy, trying to comply, trying to be, good people. There's a lot more of us. Clarity would be nice too.
Thank you, Mr. Troughton. So in addition to Mr. Troughton, a handful of individuals have stated that they did not receive the communication. I know there was a sign-in. Please make sure that we have your address when you leave here. Our commitment and goal is to reach all septic holders after the first year as these new communications and meetings take place. And so please make sure that we have your address if you don't mind. You're welcome to say it in the public comment if you want everyone to know where you live, that's fine. But otherwise you can make sure that we have that before you leave. Thank you, sir. We just want to make sure that we have a way to contact you. That a number of folks have said it in addition to you. Thank you. No, I'm sorry. Listen, you're right here in this room. Listen, this is not. So anyway, I'm going to pause you. I interjected that because we want to capture it. So this is a one directional. We're hearing you through public comment. It's not a dialogue. I take responsibility for opening up that aspect of the conversation by asking for your address, but understood. We want to make sure that everyone's reached. Yes, ma'am. Oh, sorry. Okay, I'm sorry.
C like in cat, ROTEAU. According to Article 4, Section 18-2, it states that which it takes 2/3 of the legislators to pass any of this, and apparently none of that has been done. And the last town hall meeting that we had, I spoke with Dan Eisner, ISLER. He's your health engineer. And I didn't get no answers from him. And unfortunately, there's been a certain name that's been tossed around, and that was Miss Kirkpatrick's name. And I'd like to know if she is the one that's spearheading this. Ms. Kirkpatrick, can you answer my question?
We're not allowed to.
One
go back.
directional. We're hearing public comment right now.
You're happy to call me directly. I'm pretty accessible.
I'd like to know who's spearheading this. Yes, apparently someone wants to be a billionaire, and it's not us. We're getting slammed here, and that's not right. I got $900,000 tied up into my house. Just my front yard's $100,000, and they want to come destroy it and tell me I gotta fix it, and they want to dig up my whole front yard. That can't happen, and this is not right at all. And if you guys have, I don't know if any of you have any septics, but if you do, then these comments that's on these web pages, it's horrible. No one needs this. It takes 2/3 votes from the legislative to even come up with this. So who's are the 2/3 that are voting for this? We would like to know. Thank you for your time, ladies and gentlemen.
Thank you. Good morning.
Hi, my name's Judy Heath, Heath. I live in the Children's Memorial Park area. It's unincorporated Clark County. I was one of the ones that went around with printed flyers that my husband and I put together, and nobody in my area knew anything about what was going on. A lot of my neighbors are elderly. A lot of them don't do social media. They don't do any of the electronics, any of that stuff. Some just do the news. One of the neighbors that lives over on Torrey Pines actually was so upset she wanted to be here today, but she couldn't make it. She was that upset. She feels like she's going to be homeless if this goes through. She said this is all she's got left after her husband passed. And this is all she's got left is her house to give to her kids. Most of my neighbors also have horses, cats, dogs, chickens. I mean, that's my neighborhood. Roosters that can't tell time. And if they come in and start doing anything with the septic, that's a lot of stress on those animals, and they're not going to understand why any of this is going to be done. And it's stressful enough for people my age or the elderly or anybody, especially when you're going door to door. The neighbor behind me, I am on an area that could hook up. I don't want my area trashed, but the neighbor directly behind me had just a quick quote because she had her septic emptied was $100,000, and she's directly behind me, and that would be one house back. That was just to hook up, not to run anything back. I was at a NARA meeting, which is over around Gowan and Rancho a few years ago. And they said that they had enough room for growth in the area for 8 years. If they had our unincorporated areas of Clark County, they had 30 years of growth. And Marilyn Kirkpatrick was at that meeting too. So I know she's well aware of that one. There's also something, notify you guys when we're selling a house. Why should I tell the health department if I want to sell my house? If I'm thinking about selling my house? Shoot, I barely tell my family if I want to do some of this stuff. And then, somebody else was saying that, we watch what goes down our drains more than most people with sewer systems. I put stuff over my drain so I can collect it and throw it in the garbage. I might have to run my disposal once a month just to make sure it still works. I don't run my disposal because I don't have to. I don't put anything into my septic system. So whatever's going out there, very little goes out there. It doesn't need to be. It just feels like you guys want to chart on how many times somebody, flushes the toilet, how many times somebody washes their hands or whatever. And it's like you're constantly trying to keep monitors on everything we do. And now you want to take an eyedropper full of water from us? There's not that much going to waste. Most people in my neighborhood are elderly, single living people. So that's all I've got to say. Abandon your regulations, not my septic. Thank you.
Thank you, Judy. Good morning.
Morning. My name is Robert Dreyfus and last name is spelled Dreyfus. I offer these comments for the board to consider. So they're appreciated. Thank you, Chairman and members of the Southern Nevada Health District Board of Health for this opportunity to speak. I'm a Clark County resident and a rural homeowner in Moapa with an existing septic system. I oppose the proposed 2025 ISDS regulations as they raise significant concerns regarding constitutionality, evidence, financial impact, and due process. I urge the board to reject them in their current form. Along those lines, as you've heard from many people, these regulations would appear unconstitutional. The $226 recurring fee that requires a 2/3 legislative supermajority per the Nevada Supreme Court settlements ruling, but SNHD is implementing it via rulemaking without the approval, potentially violating Article 4 of the state's constitution. Additionally, the U.S. Supreme Court, Sheets decision, mandates individual assessments for fees, which this blanket approach lacks, potentially infringing upon Fifth Amendment property rights and risking litigation. SNHD has not provided adequate evidence to justify the changes. There's no data on septic rate failures, groundwater studies using NDEP models, documented health threats, or cost-benefit analysis. Without this, the regulations seem arbitrary and violate 14th Amendment due process. The financial burden is substantial, as you've heard many of the previous comments, especially for rural seniors and fixed income households, with costs up to $100,000 for upgrades and connections. Retroactive changes to permanent permits could reduce property values, as you heard from the real estate agent, and affect housing affordability. The notification process has also fallen short of due process standards under Matthews versus Eldridge, which inadequate notice to residents and compressed timeline limiting input. So I didn't receive a card, and because I live out in Moapa Valley, right? We heard it through other people and we all banded together. So we heard it on the 3rd of October. We saw the notification of October 23rd. That's roughly a 3-week period. That doesn't allow us a lot of time to refute anything that's said or being proposed. As such, I recommend postponing implementation pending legislative majority approval, conduct independent studies to demonstrate necessity, adopt alternatives like grandfathering waivers and add an aid for low-income owners, and improve outreach for broader participation. In conclusion, reject these regulations to ensure compliance with legal standards and to protect residents' rights. Thank you for your consideration.
Thank you.
Doing a mic switch.
Good morning.
Good morning. My name is Lisa Scurro. Can you hear me? I don't know if,
Yes.
oh, okay. I live on 6245 Edna Avenue, and I found out about a card going out in the mail here at this meeting. I live in section 11, not too far away from here. We're rural preservation estates. Had it not been for my amazing neighbors, I would not have known about this meeting, so I don't have much prepared. I will be more prepared for the next meeting. I am a real estate broker. I concur with the realtor that it lives in Sandy Valley, his concerns. I bought my house. I consider it my forever home. My 87-year-old mother lives with me. I have a guest house. Again, as a neighbor stated, with 2 septic tanks. I had some numbers drawn when the sewer came down Edna. And I got an estimate just to take the front house to the septic or to the sewer. And at that time, just the trenching was $55,000. So that wouldn't take care of anything other than trenching. There would be connection fees and landscaping and re-landscaping and tearing down. So I, along with my neighbors, would appreciate transparency. Frankly, I'm pretty direct, but this seems like the the buck is being passed. This is not something that the health district should be taking up, considering I've been calling for years about the short-term rentals in our neighborhood that dump their pools on a regular basis into the street. Who knows what contaminants are in that water. They don't dump it into the sewer system, which they're supposed to do. I had one neighbor do it 3 times in 1 year and built a lazy river on that property. The trash that overflows, the things that go on in those properties that can't be done on the strip because of police and because of regulation. And our neighborhood is overrun with these homes. And there are many, many safety and health risks going on in those homes that aren't inspected. Their septics aren't inspected. And they're running illegal businesses. So I would like to know what your meeting was about the short-term rentals yesterday. Or whatever somebody said yesterday, the day before. I thank you for your time. I look forward to the next meeting, and hopefully we can just eliminate this issue, because it shouldn't be on the backs of our neighbors who take good care of their land. Thanks.
Thank you, Lisa. Hello there.
Hi, my name's Hardy Brunel. I've lived in my house over 40 years, been on septic. I built my house when I was 23. I can't afford, like anybody else, to hook up to the city sewer. And I was a general contractor. These prices are outrageous to run a 4-inch water line 100 feet. But anyhow, I just got 3 points for you guys. My apologies that the water district dumped this on you guys. And, they used to be called the water district when I was a kid. Now they're the water authority. We are in charge of everybody in Clark County. Another thing is, good thing you guys sent out a postcard saying don't come down today, or else it could have been madhouse. And third, I've always liked the health district. When I was 14, I worked as a dishwasher at Silver Nugget. And I had to go down health district on Shadow Lane and get a health card. And that was the coolest thing in the world to a 14-year-old. And then I got my wife a job at Samstown when I was 23. I went to the health district with her, and I went with her class. And that night, because her class, I saved somebody's life at Samstown after I learned how to do the Heimlich. You guys, sorry you got dumped on by the water authority, but please do us all a good job. Thank you.
Thank you.
Good morning. First of all, thanks for, I sent an email to to most of the board members, and thank you for your responses back. I'm Jim Cavin, Cavin. I live at 3020 South Tenaya Way in Las Vegas. I built my home 47 years ago. Tenaya was the last street with city water. I attended the meeting last month, and these are some of the things that I've learned. That of all the homes on Mount Charleston are up on septic systems. Some of their lot sizes are as small as 2/10 of an acre. That even if a sewer line ran down the front of somebody's house, it may still be necessary for them to add a pumping system to raise the sewage and waste from their property to get it into that system. That one size doesn't fit all, and that's what these regulations seem to have. I used to live in a rural area. I don't anymore, obviously. But there's Sandy Valley, there's Mount Charleston, there's Moapa Valley, there's Mesquite. There's all these different communities that are being placed under one umbrella. And there are different needs for each of those communities and each of those septic users. I also learned that property owners are not allowed to build on their property and because of the unavailability of permits, and sometimes a permit for a new septic system would be over $20,000. That there are 18,500 septic systems in Clark County, that very few, if any of those septic system users were notified of the proposed regulations and the changes. At the last meeting, these proposed changes were presented as a health and safety issue concerning septic systems. I asked the number of septic system emergencies that the health district responded to during the last year. I knew they wouldn't be able to answer the question at the time because staff would need to research that information. So I was wondering if that information would be available at the next meeting. Has anyone done the math on the cost for these inspections? And I apologize because I thought it was every 4 years. If we were to do an inspection every 4 years, we'd need to do 4,650 inspections a year. At the rate of 5 inspections a day, which I think is very generous, a single employee would be able to inspect 1,250 systems in a 50-week year. You would need 4 full-time employees to meet just the inspection aspect of the regulation. At the cost of $75,000 a year per employee with salary, health insurance, retirement, those 4 employees would cost $300,000 a year. Not a lot of bang for your buck. Public employees work for the public. If an individual septic system user needs assistance, health district employees should work with them directly to solve the problem. If a septic system fails or needs to be updated, the health district employee should work with them directly to assist with necessary permits at a reasonable cost to the homeowner. As long as the septic system is working properly, homeowners should not be required to connect a sewer at approximately a $40,000 cost at the low end. If a system fails and sewer hookup is available, have the homeowner hook up to sewer. It's probably cheaper than repairing or replacing the septic system at the current rates. These proposed regulations should be searching for a problem that does not exist. If this is a data-driven world, health districts should provide specific data to back up the supposition that septic systems are a health and safety issue. If it's not broken, let's not fix it.
Thank you.
Thank you very much.
Good morning.
It's Lois Thompson, and I live in the Lone Mountain area. The proposed regulations, I echo what everyone else has said, that it's going to create a financial burden on many residents. And I scoured your website and your old agendas looking for a cost benefit analysis for this program and couldn't find anything. Many rural areas don't even have any wastewater treatment facilities available. And so, or their locations or the way their properties are situated, they prohibit discharge to an existing system. So I would say that the proposed regulations do not proportionately share the benefit received by each property. And it seems like this would just expand administrative authority over private property ownership. And that's all I really have to say. But one extra comment, I think your time and money would be much better spent coming up with a solution for our mosquitoes and no-see-ums that are in the area. Yeah. So anyway, that's it. Thank you.
Thank you, Lois.
My name is,
Good morning.
hi. My name is Cheryl Pastor. Tell you a little bit about myself. I have multiple degrees, including a medical degree, but I'm not an MD. Okay. I am a retired golf professional, have been for 50 years, still a member. I've managed 2 golf courses, not in this state. I moved here 4 years ago. I've been all over the country, played golf, taught golf, managed the 2 golf courses. So operated humongous staff, and that included all facets of the facility, maintenance, everything. And when it comes to mosquitoes, the only thing you can do, and the best thing to do, is all your standing water, whether it's ponds, you've got 37 golf courses here. I've played them all. The bottom line is you have homes that have lakes in them and everything else. You use mosquito fish, and we were required to put them in. And the mosquito fish are very, very small fish, but what they do is they not only eat the mosquito, but once the mosquitoes lay eggs, they eat the larva, and you will never have mosquitoes. And when we put them in all the lakes that we had on the golf course, we were pumping both golf courses that I worked at, we were pumping 1 million gallons a night through our system, watering the whole golf courses, because it was 104 acres on each. One was 104 and the other one 108. So when you're rotating lines and doing that type of thing, then you're going to be pumping a lot of water, and you have a lot of standing water. So when you have lakes and you're moving that kind of volume of water over a large area, the bottom line is you do have stagnant water. The only thing that helps is, one, they should all have a fountain in the middle of it. You have to have water circulation. So if you have no water circulation, it produces algae. And the fact that it's very hot here makes that even worse. It compounds the problem. So you get algae in your lakes. And I see a lot of that at the golf courses, because a lot of them don't even have it. So maybe some areas, they have a small area that has it. The majority of them don't have anything. So you have to have water movement, but you also have to have the fish. And I will tell you, once you put it in, you will not have that problem. You will not have the algae problem. You're not even going to have the mosquito problem ever again. We had homes around the golf courses. We never had any complaints about anything. The worst part about it is people worried about having gophers, and the gophers would go back and forth between vegetable gardens and the golf course. And of course, we had to put gopher bait out to take care of that. But I want you to know that if you do that, Miss Kirkpatrick, you will not have to spray unless you're in an area where it would be maybe a more wilderness area. Maybe it doesn't have these situations. But this type of situation, that's what you have to do. So just from personal experience of 50 years and being well educated in the field of all of that, I can tell you it works. Secondly, I want to talk about the septic because I'm really in a pickle. I'm really banged on mine. I bought my forever home here, and I have my house is unique. It's a custom house, but it's all electric. So when I came, I immediately put solar on. So my whole half-acre lot runs on my solar panels. And of course, with the LV Energy doing what they're doing, that makes that situation worse. I have a septic tank. It's actually above ground. It's cement. It's fully enclosed and everything. Doesn't have a problem. I had it inspected and I had it pumped out 4 years ago when I moved here. And then I just had it pumped out again. So actually, for a 1,200 gallon tank, when I had it inspected, I asked them what size it was. So they told me, and it had to be pumped every 4 years. And you said 12, or 10 years is what you're proposing.
Thank you, Cheryl.
No, I'm going to talk.
No,
I'm the last one, and I'm going to talk.
well, hold on. No,
bit
hold
more.
on one second. First, let me say I think it would be appropriate to extend you for 2 minutes because you did share your insights on mosquito fish and algae removal. So you did. So yes. So we're gonna extend it 2 minutes if that's okay with you. Thank you, ma'am. Absolutely. Thank you. All right.
I didn't get to comment before, so
Understood. No, carry on. 2 minutes. Thank you.
Really depending, and I was told by the septic people that pumped it, it depends how many people live in your house. It's my husband and I. And of course, if we have relatives come or whatever, it's no big deal. But the fact is they said every 4 to 5 years, not 10 years, as you're proposing. But the fact of the matter is this is the biggest boondoggle I've ever seen in my life in regards to what the water districts want to do about using you folks as the scapegoats. And the bottom line is you've kicked the can 52 years down the road. None of you were sitting on the board 52 years ago. None of you, I already know this, none of you live in a home that has a septic tank. None of you, okay? None of the multimillionaires or billionaires have septic tanks, okay? And they don't care. All of us are seniors. I'm 70. I'm going to be 71 in a couple months. But the bottom line here is I'm retired. I have an income. I'm on Social Security. All of us are. And you've got the majority of them are. You have people that are paying multiple loans. I'm going to tell you right now, it's well more than 100,000 for me to hook up. I'm an in-house in a cul-de-sac, and it's virtually impossible. So the thing about it, my next door neighbors, they're in their 80s, original homeowners.
Thank you, Cheryl.
I have to say.
Nope, I'm sorry. Thank you. Thank you. We'll have another meeting with another public comment. Very thankful for you being here. Are there any other speakers that would like to speak during public comment? Okay. So, nope, sorry. We can talk afterwards. The time is up. Thank you, ma'am. Okay, certainly. I want to learn more about mosquito fish. So thank you all for being here. I truly appreciate your time, sharing your morning with us, for sharing your comments. At this time, hope everyone has a wonderful day. This meeting is adjourned.